So today I hereby call to order the meeting of the Community Relation Committee of Board of Directors of NYC Health and Hospital for Tuesday, September 10th, 2024. Please make note for the recorded, Deborah Brown is representing Dr. Katz in a voting capacity. I now call a motion to adopt the minutes of the May 7th, 2024 meeting. Jose Pagan,
Yes.
Chair. Dr. Patricia Morthon.
Yes.
Miss Sally Hernandez Pinero. Oh, she's not here. Okay. Miss Anita Card. Help me out here. Kamatra. Oh, I was going to say that too. And of course, Miss Deborah Brown.
Hello.
All in favor?
Yes.
The minutes have been adopted. Our presenters tonight is NYC Health and Hospital Cola, NYC Health and Hospital Jacoby, NYC Health and Hospital NCB, NYC Health and Hospital McKinley. I now turn the meeting over to Ms. Brown to deliver Dr. Katz's remarks.
Hi, everyone. Thank you so much for coming tonight. Really appreciate it. As you can tell, I am Dr. Mitchell H. Katz. My mother is very proud somewhere. A couple of things I want to just go over. First of all, big news, I think, for some folks in the room. We have 2 new CEOs in our system, which is very exciting. Christina Contreras, who has been she was the CEO at NCB previously, and then she's been the CEO at Metropolitan. She is going to be taking over at Lincoln starting September 16th. Julian John, who has been the CFO at Metropolitan and has been, very much her right hand, he will be moving up to the CEO position. So that is really exciting. And again, I will channel my inner Mitch to say, whenever we can bring people up through our system, we really prefer to. And I think, I hope that is evident with your relationships with the system, but that's something that is very important to Dr. Katz and very important to all of us. Some of you may have seen that the governor was at Elmhurst a couple weeks ago with a $27.5 million check, and that was to expand maternal and pediatric health. It was a great day, an exciting day.
Yes, that's
a lot of the local electeds were there, so very, very cool. We have, we put out so many wonderful press releases, and I know everyone can't always keep up with them, but just a couple things to hit. First of all, over 1,000 patients now have been housed in our Housing for Health initiative, and we've talked about this previously with all of you. It's actually over 1,200 at this point, folks, individuals and families to find housing through our initiatives. And as you know, one of the things we try to do is we try to leverage the land that we have in our portfolio, particularly because so many of our patients can't qualify for or are not appropriate for other terms of housing when they continue to have physical and behavioral health needs. Over 25,000 patients have worked with our CHWs, our community health workers. We have one of the largest, if not the largest, hospital-based CHW program. And this is something that's been going on since 2021. And these are people ideally from the community who can help our patients, help our neighbors navigate all of the many complexities that go along with healthcare, with things like housing, with things like food insecurity, with things like opportunities for education. So that's really something we're really proud about. Let's see. We just announced a cardio obstetric program at Kings County. I'm trying to get everybody incorporated here, which is something that's really exciting. It's $1.2 million program. It is to address maternal mortality and morbidity among women of color by focusing specifically on heart disease during and after pregnancy. It's a unique take. It's a really, I will tell you, when my team showed me the press release, I said, wait, these are models. We don't like to use models, but no, it's the physician and the patient, and just everyone was, really engaging and, ready to go. Very exciting. Um, let's see. South Brooklyn Health kicked off its plan for comprehensive women health services. This comes from capital that was funded by the Brooklyn Borough President, Antonio Reynoso, who's been so generous with us, particularly with our 3 Brooklyn hospitals, particularly in the area of maternal health, women's health, again, to address the issues of maternal mortality and morbidity amongst women of colors. All of our long-term care facilities earned 5-star CMS quality ratings. That is huge. I think you're going to be hearing a little bit about that today during the presentations, but we can't say enough good things about that. Those are huge team efforts. We have a number of our folks, our CEOs, our leaders included in various recognition lists from around the city. And a number of excellent nursing awards. One thing that some of you know, we do community murals. I hope many of you have been able to be a part of these. We just had a new mural unveiled at Gouv, one at King's as well. In addition, we've been developing wellness rooms. A lot of those come from philanthropic dollars. And so we opened one of those in Gotham, East New York. We have a couple others in the queue. And those are kind of the big things I wanted to talk quickly. I know we have a lot to get through today, but there's never ending shortage of things to brag about in this system. We are very grateful to present it to all of you.
Thank you so much, Dr. Cat slash
Thank you.
Deborah Brown. Yes, thank you. Thank you. And we will now hear from the 4 facilities presenting their verbal annual report. Each presentation is allotted. My favorite thing, 5 minutes. 5 minutes. You have to stick to the 5 minutes. And we are grateful for the work that went into preparing them. In the 5 minutes, I know that y'all have prepared and spent a lot of time on this, and we appreciate it and we're grateful. Thank you in advance to all our speakers for their time and commitment to our system. So today we will start with Ms. Verna Fitzpatrick, CAB Chair from COLA.
That's me over here.
Hear you. Hi, okay.
And I have the CEO, Mr. Catullo, here
Hi,
with
everyone.
Oh, yes. Smart lady.
me. Whatever I forget, he can fill it. Okay, so good afternoon to all of you. And I'll try to be brief as
Yes.
requested. Kohler, infrastructure and equipment. The generator replacement. As of December 2023, Kohler has installed a new permanent generator, replacing the temporary ones that were in place, resulting from Storm Sandy. Nurse call system is being replaced. It started in 2024, scheduled to be completed in 2025, January 2025. The units. On all the units, we have been very successful in replacing curtains, nightstands, overbed tables, and their rooms are being repainted. The residents are involved in choosing the colors, new blinds, and lots of work to beautify the living space for the residents. In addition, a new cable provider was chosen, and resulting from that, we have an expanded TV channel, and hopefully we'll implement a facility-wide communication channel. Electrical systems there's funding to do that, and that's on the way. A greenhouse project, we have secured over $900,000 to implement this, and the process is ongoing in the next few months. Security system, new cameras were installed throughout the facility, including elevators, and police command center was renovated. We're working to implement the FEMA-funded berm project for the 500-year flood protection of the building, which, as you know, was affected during Superstorm Sandy. The Care Experience Committee has been working diligently to enhance person-centered care, and it's a lot of positive feedback from residents, staff, and families. Meal services. We successfully launched the Kohler Cafe, and residents have been very enthusiastic, and they have rated the services 4.9 out of a rating of 5 stars. We continue to enhance on communication between nursing and dietary department, and offering residents an opportunity to taste different kinds of items and food items that are being added to the menu. Our Press Ganey survey has resulted in an increase in satisfaction across all service areas. Achievements. As you know, 5-star rating. The facility has maintained a 5-star rating in terms of quality measures and nurse staffing, and we're ranked in the top 4 to 6 facilities in the country under the Newsweek Best Nursing Home ranking system. The Beacon Award. This is a big feather in the cap of the staff of the dementia unit at Kohler. The Beacon Award, Kohler was the first facility, skilled nursing facility, to receive a silver level Beacon Award in the United States. We also have, we just completed a training of CNAs that it ended in right before the summer, and we anticipate a second cohort of potential new CNAs that are being trained at Kohler. Lots of issues in terms of beautifying the facility, beautifying the outdoors around the building. Most of you may have been to our event there back in July, and the grounds are always beautiful, right? All the efforts that we're undergoing. Resident satisfaction. One of the things that they do at Kohler is monthly brunch events, and everyone gets an enhanced meal service. And one of the areas that we do is also sponsored by the auxiliary committee. There's a wellness room and an employee dining room that both have been beautified, and if you come again, you'll see how beautiful and appealing these spaces are. Now, challenges. As you know, the facility was opened in 1952. So the physical structure is an aging infrastructure that needs elevator repairs and replacement and many other things that Mr. Catullo has constantly bombarding him with. But these are things that are part of the age of the building. And another big concern is recruitment and retention, not only of nursing staff, but medical staff and other staff members, dietary, housekeeping. And part of the reason is the aging of the staff. We have a good number of employees that are ready to retire. And the challenge of the population. 70% of admissions to the facility are individuals with behavioral health issues, therefore requiring extensive resources from nursing, social work, psychiatry, therapeutic recreation. And barriers to discharge are a big thing. Very difficult to discharge residents with these special needs. Not only their needs for supportive housing, but the issue of lack of documentation that offers a big, big impediment to discharge planning. Amen.
Thank you. I didn't have to say one more minute. Thank you so very much.
You're welcome.
So, at this time, do we have Mr. Chair?
No
Any
questions,
questions?
just the focus on quality. It's remarkable. Like on all the awards you have won on that. It tells me that you really focus on that. That's important.
Thank you.
Thank you.
Dr. Morthorne?
I just want to say thank you for your presentation. I think you're doing so much, and it's so important to the population that you serve. So thank you for the work you're doing.
We'll take the message back to the staff because they're the ones that are doing the heavy lifting.
Ms. Hernandez?
Yeah, you are incredibly busy, and I love the way you engage staff and patients in everything that you do, especially because you have a challenging population. And so finding the opportunities to really integrate them into decision making. You do a phenomenal job at that.
We made a very conscious decision a couple of years ago to move to a person-centered approach, which means anytime there's a major decision that impacts resident life and or staff life, residents and frontline staff have a say in that from the very beginning, not at the very end when we're trying to get their buy-in, but at the very beginning in planning a project. It's made all the difference in terms of staff morale, staff retention, and resident quality of life.
Miss Anita?
I don't have any questions either, but I agree. I echo what others have said. You've just done a tremendous job, and what you just said about incorporating residents and staff into the decision-making process from the beginning, that's a very advanced idea. It's not done commonly, and it's seen in the quality of your work.
Thank you.
Thank you once again. So now we call Jacoby. Miss Charmaine Grant.
Yes, thank you. Good afternoon, everyone. I'm here on behalf of Judith Benitez, the CAB chairperson for Jacoby. Okay, so I'll start with accomplishment. Jacoby is the first public hospital to receive ACS QVP verification with the American College of Surgeons. Recently received breast-centered verification. They also received accreditation from the American College of Radiology for excellence in high-caliber imaging and quality person-centered care and commitment to safety and quality. They also received Plant 3 Silver certification for excellent in person-centered care. Infrastructure and equipment. Jacoby completed project includes sinkhole remediation, roadway paving, upgrading to hematology lab, auditorium, HVAC, and audio visual upgrades. Roof replacement at Building 1. Tunnel washer replacement at Center Circle. Upcoming projects include fire alarm upgrade at Building 1, hyperbaric renovation and expansion, interventional radiology equipment replacement and room renovation, ed x-ray room renovation and equipment replacement, ongoing construction projects, wellness center, MRI and ambulatory renovation, nurse call system upgrades, cascade repair, postpartum wing renovation and modernization, second Da Vinci surgical robot installation, sprinkler installation, patient care improvements, patient-centered care, continued commitment to Plant 3 recertification in 2026 by engaging patient and families in care decisions. Patient and Family Partnership Council, shift from advisory to partnership model involving patient and staff interviews and facility renovation. Care Partner Program, expanded program to provide education and training to family caregivers successfully piloted in medical ICU and expanded to CCU, receiving positive feedback from patient and staff. Frequent complaints. Attitude and communication issue have been identified as major challenges across the institution affecting patient satisfaction globally. Despite a reduction in grievance, there has been an increase in complaints possible due to previously unvoiced issue being addressed by new rounding initiatives. Improvement strategies include, we are part of ICARE, which Kindness Task Force physicians are undergoing specialized training to improve their communication skills and nurse leadership. Nurse leaders participated in 2 weeks training program focusing on enhancing communication, allowing nurses to share expertise and information. Noise at night, addressed through a trial program including quiet time initiatives, noise meters, staff education to reduce disturbances. Quality of care. Complaints are evaluated by the departmental Aids and Grievance Committee. Plan of correction are reviewed and discussed across multiple forums. General concern, implemented press garners, consumerism platform for real-time response to patient review and social media. Issues impacting the community, served by Jacoby. Health disparities, high rate of chronic disease, example, diabetes, cardiovascular issues, asthma, COPD, and social economics factor, example, poverty, low educational attainment, impact health outcomes. Major health challenges includes issues such as low birth rate, infant high risk, pregnancies, cardiovascular disease, mental illness, substance abuse, obesity, and HIV, and so hence this report. Thank you all.
Well, thank you so very much. You really know what 5 minutes is. I think you did this in 3. So, our next, first of all, does any of the members have any questions or comments? Mr. Chia?
No.
Dr. Marthon? Miss Sally Hernandez? Miss Anita?
Not at this time, thank you.
Miss Deborah Brown? None? Thank you. Okay. Um, so our next presenter is NCB. Mr. Joe, is that Alta? Ithia. Silent N. Ithia. Chair.
Thank you, Madam Chair. First of all, I wanted to say, please excuse our leader, Chris Mastromano. There's a town hall meeting at Jacoby, and otherwise he would have been here with us.
Yes.
So on behalf of NCB, North Central Bronx received Senior Friendly Care accreditation for providing the highest standards of care for older citizens in the Bronx communities. Accreditation from the American College of Radiology, ACR, for excellence in high caliber imaging and quality person-centered care. Our only facility in the Bronx has a Go Safe Sleep champion. Receive Get With the Guidelines, Stoke Silver Award target, Type 2 Diabetes Honor Roll. In infrastructure and equipment, completed projects include freight elevators upgrades, 12A inpatient behavioral health unit renovations, Omnicell implementation throughout the clinical areas, installation of a new sterilizer at Central Sterile, new CT room renovations and equipment replacement, ongoing construction projects as boilers upgrades, Type 1 EES power separations, new generator installation. Upcoming projects include the fire alarm upgrades and sprinklers installation throughout. Energy updates, the MRI equipment upgrades and room renovations. And boy, do we need it. Patient satisfaction and safety. North Central Bronx inpatient HCA HPS scores has shown slight fluctuations from quarter 1 of 2023 to quarter 2 of 2024, with notable improvements shown in quarter 1 of 2024. NCB Emergency Department scores has continuously led the system quarter over quarter, with notable improvements shown from quarter 1 2024 to quarter 2 2024. NCB medical practice scores has been maintained quarter over quarter with an average of 87% overall satisfaction. Attitude and communications continue to be a challenge. We're working closely with our local and central care experience team to implement curriculums and trainings to enhance the patient experience through every touch point, such as eye care with kindness. Training has begun for managers and senior leaders with frontline teams to follow. We recently launched the Care Experience Committee, which serves as an interdisciplinary forum to discuss patient and employee satisfaction and collaborate on actionable items for improvement. Attitude and communication issues have been identified as major challenges across the institution, affecting patient satisfaction globally. Improvement strategies include complaints or grievances are immediately referred to the department chair, chief nursing officer, and director of nursing for the area involved, as well as the area administrator for evaluation and plan of correction as applicable. Quality of care issues are discussed in all appropriate venues, staff meetings, grievance committee, local performance and or quality improvement meetings, as well as the hospital-wide quality assurance performance improvement committee. The departmental meetings, and when deemed necessary, the medical executive committee, we continue to manage patient perception of quality of care. Health disparities, high rates of chronic disease, example, diabetes, cardiovascular issue, asthma, COPD, and social economic factors, in, example, the poverty, the low education attainment impact health outcomes. The major health challenges includes issues such as low weight infants, high risk pregnancies, cardiovascular disease, illness, substance abuse, obesity, and HIV/AIDS. I thank you.
And I thank you. Excellent, excellent. I thank you. Does any of the members have any questions or comments?
No comments, great report, thanks.
Mr. Chair,
No comments.
Ms. Hernandez,
No questions, thank you.
Ms. Anita,
Nothing, thank you.
for Brown is on here, Dr. Montan,
Just want to thank you both for your reports. Thank you.
Thank you.
and thank you once again. So now we'll go to McKinney. Ms. Deborah. Is that, you know, I was gonna say Deborah, then I said it's Deborah, so it's Deborah. Okay, okay.
Good afternoon, everyone. Greetings from McKinney. So I'll start with the infrastructure. McKinney, they completed installation of a new state-of-art nursing call bell system. We had came to the board before, we spoke about the call bell system. They replaced outdated beds with 80 new Hill-Ram beds, upgraded resident rooms with flat screen TVs, pillows, speakers, new overbed tables and nightstands. We also introduced new IV and feeding pumps. Implemented energy efficient projects, including new lighting and building management systems. McKinney also enhanced security and with additional cameras, and we acquired new rehabilitation equipment. In terms of person-centered care, we added a new patient relation representative to improve customer service, continued team monthly dinners, and hosted summer barbecues. Identified and recommended new products for resident care. We also monitored resident feedback with positive Press Ganey results. Deployed Parkinson's Foundation education and created a support group and established a Parkins song choir. Hosted weekly cooking sessions with Chef Ali. In terms of employee wellness, McKinney's H3 leadership promoted eye care with various initiatives included wellness, compassion, gratitude, stress, and stress awareness days. Plans for McKinney end of summer family games. Issues impacting the community. Residents continue to be more medically complex and younger. There are challenges in recruiting qualified staff. Ensuring occupied beds reflect the specific level of care for the resident. We have some challenges to discharge residents due to shortage of lower level alternative community-based care. The aging infrastructure of the building needs modern restoration, so we'll be asking for some money. Accomplishments. 5 stars, we received 5-star CMS quality rating and overall rating. We ranked 28 in New York State Best Nursing Homes Review. We've been awarded the New York State Nursing Aid Training Program due to commence by year end. We hired a new CMO. Dedicated staff, we dedicated Staff Wellness Center and received a massage chair for the staff. We've also organized Senior Olympics during the Summer Games in Paris. And that's the end of my report. No, we also introduced, I'm not finished. We also introduced new raised gardening beds for Gardening Club. We distributed McKinney's fresh summer produce. We also celebrated a staff member winning first place in the New York City Health and Hospitals Ping Pong Championship. That's the end of my report.
Wonderful report. So let me say to all of you, I am so, not even I, all of us, the board, and Dr. Katz is so proud of all the Council of Cabs. And congratulations to all of you and welcome back. Welcome back. Thank you. And any questions from any of the, Mr. Chair?
No questions, thank you.
I just want to
Miss Sally?
say how much I admire these nursing aid training programs in terms of being able to recruit from the community and provide opportunities. I think Kohler mentioned as well that they have a similar program. Such a great on-ramp for people from the community.
Thank you.
Miss Anita?
Nothing, thank you for the report.
Dr. Monthon?
Thank you for your report.
And again, thank you, and welcome back. That's what I say. Any old business? Any new business? Hearing none, I now call a motion to adjourn this wonderful meeting. Thank you for all your support.